So I'm going to make take a few minutes and talk a little bit about the way we do dentals at Veterinary Medical Center and the reason we do what we do and the way we do them. First, to kind of understand the basics of dental disease and the progression of dental disease, I'll take a second to talk about that. Dental disease actually starts with the formation of plaque, and plaque starts to form within a few hours of us even brushing our teeth, even in us. So basically plaque is a combination of food, saliva, and bacteria. And of course it's the bacteria that's the real problem. Even after a couple of days, as short as 48 hours, that plaque will start to mineralize and just tightly adhere to the tooth within 48 hours of the mineralization. Once the bacteria gets established in the tartar and so forth, then what it does is it invades the gum tissue, and that's what we call gingivitis. When it's gingivitis, that's totally reversible with dental cleaning and procedures that we'll talk about. After the gingivitis is established, the bacteria keeps going, it's got to go somewhere, then it invades the bone and the tissue around the tooth socket, and that's what we call periodontitis or periodontal disease. Once we get it there, then we have to do a lot more to either save the tooth or we extract the tooth. We'll talk more about that in a little bit. So the real take-home message is if we catch it when it's gingivitis, that's totally reversible. If it goes beyond that, it's not reversible. So when we do a physical exam and kind of establish that, do we need to do a dental? If we do, how much disease is going on? What will we need to do? It just starts with a basic physical exam. The dentals we do is under anesthesia. We'll talk about that in a little bit and the reason that we have to do a dental under anesthesia. But we just assess what kind of anesthetic risk are they? How old are they? Do they have heart disease? Do they have a heart murmur? We'll do blood work many times to assess what's the kidney function and liver function, etc., because of the anesthesia. We also, of course, do as much as we can looking at the mouth. How much tartar do we have? I'll use Jasper here as a little demo. And he's got a moderate amount of tartar on the teeth, which will show his actual dental a little bit later. And how much will we have to do? We try to determine that just from the basic physical and looking at them when they're awake. You can see that no dog likes their mouth looked at very much. Jasper's a nice little dog, but he doesn't let me look too much in the mouth, so we can only assess so much. But is there any teeth fractures, tooth fractures? Is there any abscess teeth that are obvious? Is there any gum or bone recession, which is periodontitis? Are there any loose teeth? How much tartar and gingivitis do we have? So the next step after we do this is we'll determine the grade of dental, try to give you an estimate for that so you can plan on that cost-wise, and then we'll take Jasper in the next step of this video. We'll actually show that his dental. Here we are with Jasper, and we started the dental on him, and we do it under anesthesia, and Stacy's actually using the power scaler to clean that tartar off the teeth, or calculus off the teeth. Maybe if you want to get a close-up of that. And so the tartar on the tooth, on the crown of the tooth, is actually the least important part of the dental for the pet. It's the only part that the owner can see, but it's the least important for the pet. And the reason is that we need to get cleaned up under the gum line, which is where the dental disease continues to progress after it gets on the tartar, as we talked about a few seconds ago. So we do several steps. Stacy's charting as she goes along. We have a dental chart here that any abnormalities. We actually found a fractured tooth. The tip was fractured, which I didn't see in the exam room, but we did notice here, so we have an x-ray of that. So after she does the power scaling, she's actually a good segue here. She's actually doing the hand scaling, and we get up under the gum line, which is the most important part. If we don't clean up under the gum line, the gum disease will continue to progress, and just cleaning the crown, the tartar off the tooth, does absolutely no good whatsoever without cleaning under that little sulcus in under the gum line. So that's what makes it tender on us when we go to the dentist and we kind of have a little bit of sensation after we come out. After we do that, we also probe, looking for pockets, which are areas of infection that may go up under the gum line a little bit. We also take x-rays, which is a vital, absolutely 100% necessary part. And you can see here's an x-ray that Stacy just took on Jasper on the other side, because she just started cleaning his right side, and this is off the left side. This is some molars, so that's how we determine a lot of the dental disease. About 2/3 of the tooth, or maybe 3/4 of the tooth, of the entire tooth is up under the gum line. You can't see it unless you take x-rays. I can't stress how important x-rays are. After we do the charting, looking for fractured teeth, probing, looking for the pockets, taking x-rays, and we review those, and of course the basic cleaning and dental, we also polish the teeth, because that makes the tooth smooth. The little micro etches that are left on the tooth surface, the enamel surface, will actually collect plaque and tartar much more easily, so we smooth them. It's not to give them a bright, shiny, white smile. There's actually a reason for it, then we flush the mouth out. So that's the basic procedure in the dental for his fractured tooth. It looks like the pulp is exposed, so we may have to go and address that, and that's the basic dental that we do on dogs. Obviously it's done under anesthesia. The main reason is we can't clean up under the gum line, we can't take x-rays, we can't probe for pockets, and we can't polish. The only thing we can do without a dental is cleaning tartar on the crown of the tooth, which if gingivitis has already started, it does absolutely no good whatsoever for the dental disease. That's the problem with anesthesia-free dentals. That's also the problem if you do dentals where we don't take x-rays. It's also a problem in dentals where we don't chart and probe. It's just inadequate dentals. Because we do it under anesthesia, we also take a lot of efforts. This is actually a warm air blanket that keeps them warm, because getting cold body core temperature is a problem with anesthesia. It's off right now because it makes too much noise for the little video I'm doing. We monitor blood pressure with this. We monitor pulse oximetry, the amount of oxygen that's in the bloodstream, and we have a monitor that tells us if the respiration is normal. So, and we take those. We take the vital signs and the blood pressure and so forth every 5 to 10 minutes, depending on how stable they are and so forth, if we have any questions with that. So the next step will be, I'll show Jasper after he's awake, and probably the anesthesia we use, he'll be up and around, probably ready to go home in about within an hour or so, looking pretty well. We'll see that. I also do nerve blocks if we do anything that's painful to the teeth, any periodontal surgery, any extractions, we do nerve blocks. That way it's they aren't having any pain sensation when they go home. It does wear off eventually, of course. It also allows us, when there's no pain sensation, to keep the anesthesia much lower, and that's much safer for your pet. Alright, so the last part of the video here, this is Jasper. This is about an hour, just a little bit over an hour after the dental. You can see he's ready to go home, definitely awake. Wants out, can't wait to go, and that's the goal as we do the dental. He apparently is pain-free. I used a nerve block to take away the pain, and I actually extracted a fractured tooth, a little incisor up here, and he seems no worse the wear for it, and that's our goal. So that's a short little hopefully education on how we do dentals, why we do them, why we do them under anesthetic. There's so many, most of the parts of the dental we can't do without anesthesia. If we don't take x-rays, if we don't probe, if we don't clean under the gum line, it's actually malpractice in our opinion here.